I'm going to talk a bit about shortage plans. I know we've just literally come out of an Amber Alert. So this is the JPAG website where you can get all the shortage plans, the red cell platelets, which we've had for a number of years. They were updated in the summer when we knew that we were heading towards trouble. There's also a plasma shortage plan on this website, which was written for the first time in August because we did run into some problems with plasma for a few days. Thankfully, nothing more than a few days. But within this website, you will also see that there is a guidance on triage tool for rationing of blood for massively bleeding patients in the event of a national shortage. And I think this is a paper that was written by Mike Murphy, Laura Green, Heidi Doherty a few years ago and updated last year or the year before. It is for England, but we are looking at making this UK guidance. And I think in the context of what we've just been through in Amber Alert, it's really worthwhile reading this. It gives you a sort of a guidance as to how to triage someone who's having a massive bleed. And there are two appendices at the back. These flow charts are probably the most useful bits that you want to look at because it will guide you through what to do in a massive hemorrhage. So that single individuals are not making that judgment call at the bedside, that they do have some guidance to sort of look at to sort of help them make those tough calls. As I said, we are looking at revising this so that it's UK guidance, and it may change a little bit, but I don't see that it will change that much. So it's worth looking on the JPAG website to see this. We've just came out of Amber Alert yesterday, and all of the guidance that has been written over the last 5-6 weeks has been placed on the bloodstock page under bloodstocks, just below where you see the daily reports. We are currently still below green phase for A positive and B negative. I think 4.8 and 5 days of those groups, but everything else has gone into green whilst we've been in this Amber Alert, where we've asked our surgical colleagues to postpone surgery in priority 4 patients as according to the Royal College of Surgeons, and on our shortage plans that's category 3 patients. We've also asked for some things to be done for medical patients to help, because when we did our modelling we recognised that actually surgical or surgeries of that nature would only decrease demand by about 1.2% or something very similar, so very low. On this slide, you can see that all the guidance that has been written, and I would advise you to go onto the website and have a look, because it is really stuff that's been written in a hurry, but actually with involvement not just from NHSBT colleagues, but also NHS England and Royal Colleges. So I would urge you to look at this page to go through this guidance. On this slide, you can see that we have put together PBM toolkits, which have been there in the background for a number of years, but possibly not as easy to find as we would have liked them. And more recently, we've added some infographics on tranexamic acid. But you can find all of these toolkits using this web link. And just to give you an idea of what the infographics for tranexamic acid is, this is it. So one for patients and one for clinicians. The infographics are there for you to use in your trust. Use it as screensaver or poster, tweet, whatever you like, but please do use it. They've been endorsed by the Royal College, so Royal College of Anaesthetics, Royal College of Surgeons, and Royal College of Pathologists. So the AMBER guidelines are there on that page. There's a section for laboratories as to what to do. There's also a section for all patients, so it's really focusing on appropriate use of blood. So looking and identifying patients who are about to for anemia, so iron, B12, folate, and replacing that. Minimizing iatrogenic anemia by sort of reducing sampling to only when it's going to make a difference to your management. Using restrictive red cell transfusion thresholds. So dropping the hemoglobin threshold down to 70 from 80 and using the single unit policy. And in an emergency, in a major hemorrhage, really the decision to transfuse should be led with the most senior person, ideally a consultant. And obviously, if there are any delays, then you want to be, if there are any delays, any untoward incidents, please report to SHOT. So we've got some guidance here for surgical patients. I'm not going to go through all of this because you can look this up yourself. The big difference from amber to pre-amber is this: the in amber, patients who are P4 category, as according to the Royal College of Surgeons, who are expected to need blood component, were asked to be postponed to such a time when we're out of amber. And then there were guidance for those patients who are on a chronic transfusion program. And in fact, from all the data that we've gotten back, it's the medical adjustments that have been happening out in hospitals that's made the difference to our stocks, that's allowed our stocks to build up over the last 4 weeks. And we all know that actually hematology patients are the biggest group of patients that use blood components, and particularly those patients who are on chronic transfusion programs, whether they're hemoglobinopathy patients or hemonc patients. So the Preamber Guidance, so this is the phase we are in now, and we're expected to be here for a number of months, well into 2023. Again, the guidance is for laboratories, all patients, surgical patients, and medical patients. So I would urge you to have a look at that. It is basically ensuring that you employ all those patient blood management techniques like tranexamic acid, use of iron pre-surgery, or in medical patients who are hemodynamically stable, do not transfuse, give iron or hematinic replacement. And in those chronically transfused patients, particularly if they're red cell exchange patients, if they've got sickle cell disease, try and make sure that you are ordering blood that you know you will only use, so that you're not wasting, particularly of those RO units, which are really precious. And you want to make sure that if you've got a depletion mode in your exchange machine, that you do so, and because it uses less blood. And the big difference to this in Preamber is that in amber we said try and not aim for a really low hemoglobin S. So if you're aiming for something below 15%, it uses up a lot more units than if you sort of aim for 15 to 20% or 30%. So that's the big difference between amber and Preamber.